Well, this is Respiratory Care Week. It's a great chance to understand lung health issues and learn about the important benefits of respiratory therapists who bring patient care. Joining us this afternoon is Clark Curry. He's a registered respiratory therapist with Hendricks Regional Health. Thanks for joining us here today. Let's begin here at the very beginning. First of all, what is a respiratory therapy?
Great. Well, thanks for having me. I appreciate it. Respiratory therapy entails a wide array of things that we do, but just to summarize quickly, we work with physicians and nurses side by side to help develop care plans for patients with respiratory illness, whether that be acute or chronic, different respiratory diseases, patients that are on life support, and things like that.
What are some of the common respiratory conditions that you see in your office and that you treat?
The most common ones are going to be asthma, especially this time of year, COPD, which entails chronic bronchitis and emphysema, a few little-known things like pulmonary fibrosis, and lung cancer, things like that as well.
And I know that this time of year it can be difficult on some people to really breathe. So what are the symptoms of respiratory problems, and that really kind of triggers something to say, I should have this checked out?
Mainly if you're having trouble breathing, obviously, if you're feeling short of breath, especially while sitting down, something that you haven't experienced before, you're not able to catch your breath. That's going to be one of the main things. And also, if you're having any chest pain, any pain in this area here, when you're taking deep breaths, things like that, those are the most common things.
And I know we come into the hospital, we see you kind of give us a prognosis, but what are the treatment options that are available?
Sure. Things that we provide as respiratory therapists are breathing treatments with medicines like albuterol, inhaled corticosteroids. And to get to more serious issues, we help manage ventilators when people have to be on life support, things like that, and help them hopefully recover and get them feeling better. And you can even go to patients that have had heart surgery, to children in the NICU, things like that. Like I said earlier, it's a wide array of things that we do as respiratory therapists.
This time of year, we really think about fall foliage and the leaves turning colors, but this can really be a difficult time for people who suffer from lung disease. Why exactly is that?
The change in the weather, going from hot to cold, especially here in Indiana, where it can be 80 degrees, in the morning, and then at night it can drop all the way to 50. That affects people with asthma and COPD. It affects the way they're able to breathe, and people are still out there mowing, so you're still getting those people with the allergies to grass and things like that. So that's kind of the hardest part about the fall for those patients and those people.
All right, very interesting perspective. All right, Clark Curry, thanks so much for joining us here with Regionals Health. We've learned a lot about the conditions and what we need to be on the lookout for.
Thank you.